Good morning, Assalamu alaikum, distinguished speakers and my guests and fellow native Rohingyas. As we all know that experts and speakers have been talking on going genocide within in Myanmar against Rohingyas. So not only that, there are global institutions like International State Crimes Initiatives, Human Rights Watch, Fortify Rights, Queen Mary University of London, Yale University Law Clinic, University of Washington Law School. They have visited our Rakhine State in Myanmar, and all their fingers with their informations, facts and figures lead to the conclusion that Burma or Myanmar regime is consistently commissioning crimes against Rohingya humanities, genocide on Rohingya. There are many ways how to extermination phase can be materialized. Now, I would like to talk on some consequences on healthcare denial still being used as genocidal tool in Arakan against Rohingya. MSF International is one of the largest and the main healthcare providers to Rohingya in Arakan State. Suspension in 2014 and later with increasing restrictions from authorities, their activities and projects have been significantly affected. Public health of Rohingya living in IDP camps and open prisons being worsened. Restrictions of movement on Rohingya is another made obstacle that 90% of the population become inaccessible to formal health care. The majority of deaths in children under 5 each year are avoidable mortality, that is, deaths due to illness such as malaria, diarrhea, measles, malnutrition or respiratory tract infection, which can be generally prevented or inexpensively treated. Here is an image which is a very disturbing. She is a lady, Anjum Begum, who lived in Situay IDP camp, died this year in March due to 2 years of suffering from mouth and jaw cancer. So when we are talking about the genocide tool used by the Burmese regime, we Rohingyas, a group called Doctors for Humanity, has witnessed this denial of health care. Doctors for Humanity is a group of Rohingya doctors living worldwide and supported by like-minded Rohingya volunteers working association with Mayu Aid Team for Humanity. It was formed when MSF was driven out of Rakhine State in 2014 to help Rohingya with advice and consultations. We have covered patients in Situay, Paktau, Mrauk U, Chokto, Minbya, and around 15,000 cases have been consulted. Most of our cases were labor complications and liver cirrhosis till today. Rohingya in Arakan, particularly in IDP camps, have limited access to food, and that comes to starvation is widespread. Adequate frequencies of meal and basic nutritious food, which are important for proper human nourishment, is non-existent in IDP camps. Recent information showed that they are relying on only 1 meal per day, which is also mostly single ingredient meal, which is rice and water. Malnutrition and anemia is very common among under 5 years age of Rohingya children all over IDP camps. Severely malnourished children number drastically increased recently as per European Union agency, and it could be expected more in 2016. According to UNICEF, malnourished children are 9 times prone to death than normal children. Reasons leading to malnutrition, anemia, intrauterine growth retardation are directly proportional to government blockade on AIDS, restriction on NGOs, and of course, expulsion of MSF from Rakhine State. I will show you some pictures of just recently from this year. This is a very malnourished child in IDP camp Sittwe, Rakhine State. There's another malnourished child in Sittwe, Rakhine State. Rohingya have very limited access to emergency healthcare service. Freedom of movement is severely restricted, so reaching to medical facilities is unimaginable. Alarming rate of maternal death are recorded since 2012 among Rohingya pregnant women. Due to delay reaching to clinic, hospital after passing many bureaucracy, many pregnant women were returned either dead with their inborn child or with their child. Medical negligence internationally is widespread due to obsessive racial hatred. One incident happened last month. There were 4 ladies admitted in one-day normal pregnant women for normal deliveries, and none of them was survived. No death certificates were issued to cover up all the mistreatment done by medical staff. So this is the victim from this incident, and as I've said, that she was normal and then she died there. There's another, she was late 30s in Pakto IDP camp, died in 2014 in April, and the cause of the death allegedly by deliberate medical negligences. This is another recent one. I think last week, Bashir Ahmad, Rohingya man, was attacked by Rakhine's extremists in Pakto Township, Arakan. Due to travel restrictions, no emergency medical service was received. Infectious disease is a major threat in Arakan state, and particularly in IDP camps. Lack of infectious diseases control is another fatal factor for Rohingya. Lack of health service provider, MSF, have increased the drug-resistant infectious diseases such as malaria, hepatitis, tuberculosis, dysentery among Rohingya community. Poor sanitation and lack of clean water in IDP camps increase waterborne diseases. Hepatitis and its complication, which is liver cirrhosis, are at the alarming rate. Intrauterine growth retardation and intrauterine death are very common among Rohingya in Arakan. Usually, HIV or AIDS cases are very low among Rohingya community, but it is also increasing due to unsterilized medical equipment, especially needles used by the Rakhine's medical staffs. Some HIV infections are results of gang rape by Myanmar military forces on Rohingya girls. So I will show you some pictures again. This is a girl, 3 months old, died due to fever and diarrhea in IDP camp in Pakto, Rakhine in 2014. There's another child with a skin infection, also in IDP camp in Sittwe in 2014. And here's another one, 54-year-old Rohingya man in IDP camp from tuberculosis. Due to restrictions of movement of Rohingya and with no foreign medical NGOs, it is challenging for health workers to reach out to the children, especially under 5 years of age, for vaccination. Significant increase in incidence of vaccine preventable diseases like measles and rubella. Maternal and neonatal tetanus are widespread, though it can be prevented by simple vaccination. Poliomyelitis, complete eradication has not been done in Rohingya IDP camps. No integration of immunization at the delivery level with infected hepatitis and HIV's mother. There's another, a state is sponsoring prosecutions on Rohingya since 2012. There's a drastic increase of depression, post-traumatic disorder among Rohingya population. Rape victims and the family members are stigmatized, isolated, and there is no formal counseling nor receive justice. In a single village, Bagona, Mangdo, 22 women have been raped by security forces in June 2012 alone, and one of them was my auntie. Victims come to death due to internal injuries as well as of trauma. Hospitals don't admit the victims so that they don't have to issue many medical reports against members of military. Rohingya children are being brought up under constant fear, intimidation, and stigmatization, which are fueling factors towards full-fledged genocide. So I'm going to show you just a very quick picture. This is a Jamila Khatun, was gang raped in 2014 in Baudupa IDP camp. There's another lady, several rapes by Burmese forces against Rohingya in 2014. So let us go and have a look at the poor records, healthcare records. The national average of doctor-patient ratio is 1:700 and 800, whereas for Rohingya is 13,000. We might not agree with Dr. Saad, but we will talk about it later. Maternal mortality rate is 380 deaths per 100,000 lives birthed in Mangdo Township, which is double of UNICEF figures. Under 5 years mortality is 135 children per 1,000 compared to 77 children national average. 5,000 pregnant women live in IDP camps who should receive regular checkup and access to hospitals, clinic, but they don't have access as per UNFPA. 40% children under 5 years suffering from diarrhea. Malaria and complications of hepatitis are the major causes of death and illness of Rohingya adults and children. Average life expectancy in Myanmar is 64 years old, whereas for Rohingya is much lower. Unfortunately, now many do not even reach 55 due to lack of medical care, starvation, or Rohingya men picked up at night and never returned back home. So I'll show you just one picture. This is the makeshift pharmacy in Sitwe IDP camps. What I wanted to say that Burma has marched to democracy, and again, Rohingyas are left out. Aung San Suu Kyi has been giving indications that she needed some time to still the rolling waters of national politics, but now she's finally gave up to the hands of ethno-religious bigots. The only remaining hope for the Rohingya community who are suffering within Burma is the international community. Thank you very much.